Welcome to Module 3, Culturally Responsive Family Engagement, a resource for the implementation of strengthening partnerships, a framework for prenatal through young adulthood family engagement in Massachusetts. This session was designed to ensure that family engagement programs and practices are culturally responsive. Culturally responsive family engagement is a key component that is woven throughout the family engagement framework. You can download the framework at this address. Feel free to pause this recording and write this address down. When you're ready to resume, hit play. The intended outcomes for this session are to give participants a higher understanding of the definition of culturally responsive family engagement practices and inclusive family engagement. Participants will learn how to apply elements of the framework to develop their own culturally responsive practices. Let's start by defining the framework. The framework was developed to give organizations, families, policymakers, and other stakeholders a roadmap to create equitable family engagement policy, programs, and practices to build the capacity of both families and professionals so they can develop meaningful partnerships that contribute to child and youth success. This is an intentional approach that will engage all practitioners and families, not just families with privilege. Meaningful and long-term family engagement can be established only when organizations create a systemic culture of engagement and collaboration. Creating a culture of family engagement involves a primary and ongoing focus on engagement rather than a series of isolated or arbitrary efforts. An organization wide culture of family engagement requires all staff in the organization, irrespective of their roles, to embrace the importance of engaging with families. A strong culture of family engagement is respectful of families and grows and evolves with the needs of children, parents, families, and practitioners. The organizational leadership needs to continually address the coordination, improvement, and sustainability of existing family engagement policies and practices within the organization, as well as between organizations and stakeholders within the community. This framework was developed to help organizations, practitioners, and families create that culture that values and thrives on family engagement and to help them strengthen their family engagement practices that will lead to better outcomes for children, youth, and families. A look at the framework development process is helpful in thinking about how the framework can support the implementation of good family engagement programs and practices across sectors like education, health, and social services. In September 2017, the state of Massachusetts engaged in a technical assistance opportunity through the Council of Chief State School Officers with support and guidance from the National Association for Family School and Community Engagement, the Policy Equity Group, the Mid-Atlantic Equity Consortium, and the Campaign for Grade Level Reading to collaboratively build a prenatal through post-secondary family engagement framework for use in the health, human services, and education sectors. The development of the Massachusetts framework was led by a three-agency partnership, including the Department of Elementary and Secondary Education, the Department of Public Health, and the Department of Early Education and Care. They organized the meetings and agendas and led the development of the Regional Family Engagement Coalition. Additionally, they worked with key state and regional partners to build that coalition. The coalition included participation from 11 state agencies across the health, human services, and education secretariats. The Regional Family Engagement Coalition grew to over 500 practitioners and family members over the course of 3 years. and also represented diverse perspectives and sectors, including health, human services, and education. More specifically, practitioners on the regional coalition represent the perspectives of health, libraries, museums, early education and care programs, home visitors, human services, school and district administrators, and higher education faculty, just to name a few. The Regional Family Engagement Coalition provided an opportunity for the state agencies to partner with and to hear from a diverse group of stakeholders, practitioners, and families to inform the development of the framework and its implementation. The Regional Coalition met in 3 different regions about 3 times per year. They shared their thoughts on what should be included in a prenatal through post secondary family engagement framework. Then they met to review various parts of the framework to make sure their voices had been heard and to react to what was written. Once the framework was complete, the regional coalition met to inform the implementation plan and strengthen capacity. In addition to participation in the regional coalition meetings, families and youth focus groups were conducted to ensure that their voices were heard and included in the framework. Through family and youth focus groups, the coalition gathered information about what's important to families and youth related to engagement and to ensure that barriers that they've encountered were addressed in the framework. As a part of the implementation process, the state coalition hosted listening sessions to ensure the voices of youth, families, and practitioners continue to be heard. Additional research that contributed to the development of the Massachusetts framework came from the Dual Capacity Building for School Family Partnerships framework, the Parent, Family, and Community Engagement Framework for Early Childhood Systems, Strengthening Families, and the Maternal and Child Health Family Engagement Framework. These are frameworks that have strong roots in current Massachusetts family engagement practices and were used to inform the development of the new framework and to create alignment across sectors. The new framework doesn't replace any of the frameworks listed on this slide, but instead creates a common language and approach to family engagement that can be used across communities, organizations, and sectors. There are 4 elements that provide a foundation for this framework. Each element builds on the previous element. The first element is building positive relationships. The second element is promoting family well-being. The third element is promoting pathways for partnerships with families. And the fourth element is supporting child and youth development and learning. These elements build on each other. For example, practitioners are better positioned to support family well being, which is element number 2, after they establish a solid and positive relationship with families based on mutual respect and trust, which is element number 1. Underlying all of these elements is the understanding that the family plays the most pivotal role in this partnership and should decide the trajectory of the relationship. Practitioners need to meet families wherever they are and focus on their individual needs and expectations. Additionally, they should also recognize diversity, such as cultural diversity, multilingualism, and diversity in family structures. Those are assets to foster positive and healthy partnerships with families. The focus in this module is culturally responsive family engagement practices, utilizing the guiding principles and elements of the framework as its foundation. So let's dive in. This is how the NYU Metropolitan Center for Research on Equity and Transformation of Schools defines culturally responsive family engagement. Culturally responsive, sustaining family engagement will, by definition, look different for each community and organization within it. The best plan will be created not by one person assigned to the task, but through creative brainstorming and innovation with practitioners, families, community members, rooted in a deep understanding of the social identities and patterns of the community. In this module, we will look at 5 different practices that lead to culturally responsive family engagement. First, we should always start with building relational trust. That's the foundation of all family engagement work. Another important part of this work is acknowledging personal biases and avoiding assumptions. One really important practice that helps to build cultural responsive family engagement is learning about children, youth, and their families. Another important practice is to value families' funds of knowledge and ensure the work you do with them is based on a strengths based approach. Finally, we'll look at meeting families where they are and reaching beyond those families that show up. The next few slides will examine each of these practices more closely. However, before we move on, take a minute to pause this presentation and think about an example of family engagement that embraces all of these culturally responsive practices. Maybe you have practices in your own work that address these already. When you're ready to continue, just push play to resume. It's important to reach out to families to build relational trust. But if a family is very reluctant to meet with you, respect their wishes and understand they may have good reasons for it. In the meantime, be sure that every interaction you have with families is positive, purposeful, reciprocal, and consistent. There are a few steps you can take to begin to develop those trusting, respectful relationships. First, accept and celebrate all differences. It's okay that not every family is the same. In fact, those differences make us stronger. Be sure when you do communicate with families, you are actively listening and effectively listening. That goes a long way towards starting to build trust and demonstrates the respect you have for families. Be generous with your time and always be present when you meet with families, whether that's in person, online, or over the phone. Develop your own communication skills. If you know you aren't great at a particular communication strategy, practice until you are. There's not one strategy that works with every family, so the more you can become fluent in, the more successful you'll be. Learn to trust more. Remember, families love their children and they want the best for them, so always assume they have good intentions. Finally, treat people the way you want to be treated. You can never go wrong if you follow that simple rule. Everybody's brains take shortcuts to better understand the world around them. It's instinctive to try and categorize people and things based on your own experiences and what you can easily observe. While that saves time, it can also lead to assumptions and actions that reflect our own bias. Usually, this is subconscious. The way to work through that is to start by being honest about the stereotypes that affect you. There are a lot of tools you can use online to help you work through your own biases and assumptions, like the implicit association test from Harvard. You can find it at https://implicit.harvard.edu/implicit/take a test.html. Another strategy that is very helpful is to focus on people. If you look for magazine articles or blog posts with positive messages about people you may have had a negative stereotypical thought about, you're more likely to overcome those unhelpful thoughts and begin to break down those stereotypes. Try to celebrate the success of people from a wide variety of backgrounds to move past any other subconscious bias you may have had. Another strategy to help you move past your own bias is to use language that's clear and unbiased. Using words like they or phrases like he or she instead of using a masculine pronoun when gender is unknown can help you avoid assumptions. The third responsive practice is to learn about children, youth, and their families. The more we know about people, the less likely we are to hold negative thoughts or feelings about them. Try to start every interaction with something positive. That just gets things off to a good start. Then continue to use positive interactions every chance you get. When trying to find out about personal information, it's often easier if you share something personal about yourself. That often signals to others that you care and you're willing to have an open and honest dialogue with them. Also, consider using simple questionnaires or surveys to get to know people better. This is the golden age of technology, and many people are able to access those online. So you can use those to obtain some information to get you started. If they don't have access to technology or are uncomfortable using it, set up a time to do interviews with them in person or over the phone. You may want to use that time to ask them about their child's strengths and interests or about the hopes and dreams they have for their child's future. That's not a question people typically ask, and a lot of families really like having the opportunity to focus on their own end goals. It's also important anytime you communicate with families to do so in the primary language spoken by the family whenever possible. The fourth responsive practice is valuing families' funds of knowledge and working with a strengths based approach. That starts by acknowledging that all families have strengths. You have to recognize and respect that whatever their life circumstances, they have many strengths to build on. Also, we must respect and learn from the differences families bring to the table. That richness of diversity strengthens us all. So, the more we can engage with and learn from families, the broader our own perspectives become. It's important to show an openness to adapting your own practices to family preferences. Not every family will want or need the same things. We have to adjust our own practice to meet them where they are. Another important strategy is to share decision making with families. They know their families best, and they've got a vested interest in their own success. Trust them to work with you and give them all the information they need to make informed decisions with you. Finally, always approach families as equal and reciprocal partners. They can tell when you don't, and that can cause trust issues. Make sure families know that you see them as partners and want to work together to ensure their child's success. The fifth responsive practice is to meet families where they are and reach beyond the families that typically show up. You can start by asking them how they prefer to be reached, and then once you know, try very hard to reach them that way. There's nothing worse than telling someone you prefer to be contacted by phone, but then they continue to email you. Also, give families multiple opportunities to be involved in your programs in a variety of ways. That may mean offering them opportunities to do things in person when feasible, or to do things from the comfort of their own homes. Offer lots of different types of activities whenever possible to appeal to lots of different families in a variety of settings. And finally, reach out to families who don't show up or can't show up. You should never try to guess why they aren't there. More often than not, you'd be wrong. It's much easier to ask them what's preventing them from participating and then work together to remove those barriers. Now let's take a look at some model programs and strategies. Take a minute to pause this slide and read this scenario. When you finish reading, hit play and resume. So, what next steps do you think would be helpful for Mrs. Juarez as she supports the Brombat family? Given what we've learned in this course, how is simply setting up appointments for their family not enough? If you need to reflect on these questions for a moment, feel free to push pause again and resume when you're ready. Here is what happened when Mrs. Juarez investigated the situation. She was very surprised to learn that the interpreter sent to the home didn't speak the same language as the Brombat family. Of course, Mrs. Brombat didn't feel comfortable stopping the meeting. When she learned what had happened, Mrs. Juarez was able to help them reschedule the evaluations and assessments for another time with an interpreter who spoke the same language as the Brombat family. She also spent some time explaining the need for the meeting in greater detail so that Mrs. Brombat would feel even more comfortable at her next appointment. Mrs. Juarez was a cultural broker. Cultural brokers function as a cultural bridge between diverse communities and mainstream service systems. As a member of the local Hispanic community, Mrs. Juarez understands how her community might be different from the mainstream service systems culture, and she can help others from her community navigate those systems. She can also help those in service systems better understand the community she comes from. Part of understanding those differences is understanding and appreciating the nuances and values from each of the cultures. She can help practitioners and service providers understand and even celebrate some of the differences in views, values, and beliefs. Cultural brokers must be supported to be effective. They require professional development, and so do the leadership and staff in the agencies where they work. Everyone needs to understand their role for them to be most effective. Ideally, culture brokers should come from the community they serve. This maximizes their background knowledge and existing relationships as they foster other relationships between families, organizations, and practitioners. There must also be meaningful opportunities for the voice and expertise of cultural brokers when it comes to planning family engagement events or activities. They should have a seat at the table during planning to ensure they're able to identify the best way to connect with other cultures. This is scenario 2. Take a moment and pause this slide and read this scenario. When you finish reading, hit play and resume. As you think about two-way, culturally relevant communication, what are the steps you would recommend for Mary Esther moving forward? Considering what we learned through this course, how is simply translating the letter insufficient? If you need to reflect on these questions for a moment, feel free to push pause again and resume when you're ready. Two-way culturally relevant communication is intentional and planned ways to transmit information in families' home languages, providing means for families to ask questions and ask for clarification on communications. When letters or emails are sent home, care should be given to explicitly assure families' understanding of the messages. Many organizations hire translators to comply with state and federal legislation and also to assure communication of the messages in families' home languages. While this is an excellent and necessary practice, it doesn't always connect communication to learning. In order to make communication two-way, families should understand how and be encouraged to respond to those letters with follow-up questions, which requires that the family has a trusting, respectful relationship with the practitioner and or the organization engaging in the two-way communication. Some of the strategies we might suggest to Maria Esther could include working with practitioners to fully realize the organization's vision for family engagement and tangible next steps. She could also reach out to family engagement staff or local cultural brokers to work together on how families might support their child at home. Another strategy Maria Esther might use would be to work with the practitioners to better understand how families can access information about social emotional development, mental health, and developmental transitions. That would also be a great time to double check that the organization has the preferred means and times to contact each family and schedule follow up calls. Connect with families. They are the starting point. In fact, Warm handoffs are a really good way to support families across services and follow up with them to see how things went. A warm handoff is a handoff that's conducted in person between practitioners with the family present. It's a great practice that alleviates any communication issues and helps to support relationship building as families move between services and practitioners. This is scenario 3. Take a minute and pause this slide and read the scenario, and then think about the assessment questions. When you finish reading, hit play and resume. Why do you imagine the Jones family was suddenly hesitant to make or show up for appointments? As you think about Mary's struggle in scheduling appointments for the Jones family, what steps would you recommend for Mary moving forward? Considering what we've learned through this course, in particular this module on culturally responsive family engagement, how is simply attempting to make repeated calls for appointments insufficient? If you need more time to think about that, please feel free to push pause and hit resume when you're ready to continue. When Mary was having some coffee with her coworkers and complaining about the Jones family, one of her friends suspected she knew the cause of the tension. Roxanne had overheard Mary commenting to the family that Jake's dreadlocks were unclean and they might want to think about styling his hair in a different way. Mary didn't realize the dreadlocks were a cultural tradition in the Jones family, and when she mentioned they were unclean, the family felt disrespected. Mary didn't intend for them to feel that way, and she didn't realize the dreadlocks were an important part of the Jones family culture. After her talk with Roxanne, she realized she had some implicit bias and had broken the trust the Jones family had placed in her. Mary knew she needed to do some work to address her own cultural awareness and that she had to take some steps to rebuild trust with the Jones family. What steps would you take to rebuild that trust? Recognizing and dismantling implicit bias isn't easy, but it can be done. Here are 4 steps you can take to begin to address your own implicit bias. First, when you recognize you are stereotyping people, reassociate them. For example, instead of a negative association like Black children are loud and disruptive, reframe your thinking to Black children are enthusiastic and energetic. The second step is to refute or counter your stereotypic imaging. Often, when people have a stereotyped image of another group, they look for evidence that reinforces their own belief. Instead, look for evidence that refutes that belief. The third step is perspective taking. That means changing your own perspective. Put yourself in the shoes of the person you've been stereotyping. Imagine what they're going through when people make false assumptions. And then finally, look for opportunities to increase the positive contacts you have with people in the groups you've been stereotyping. Seek out positive experiences with people from a group you stereotyped. It's a terrific way to begin to see things you have in common and overcome your own implicit bias. Here are some of the resources that were used to develop this module. You may want to explore their sites if you're looking for additional information. Feel free to pause this module and check out some of the other resources for culturally responsive family engagement. Just hit play when you're ready to resume. Let's take a look at some of the key findings or takeaways from this session. We covered a lot of information in this module. Some of the important takeaways from this session relate to culturally responsive family engagement practices. Those practices always start with building relational trust. It's also important to acknowledge your own biases and avoid making any assumptions. Another important strategy is to learn about children, youth, and their families. That will make it much easier to value the family's funds of knowledge and work with them from a strengths based approach. Finally, To be truly culturally responsive to families, you have to meet them where they are and do some outreach to connect with the families that don't always show up. This was the third module in a series of modules developed to help implement Strengthening Partnerships, a framework for prenatal through young adulthood family engagement in Massachusetts. The other modules include an introduction to the framework, a deeper dive into the framework, and where do we go from here with the framework. If you need more information on the modules or the Massachusetts Framework for Family Engagement, please feel free to contact the Massachusetts Statewide Family Engagement Center. Their contact information is on the screen. Thank you so much for joining us today.